Welcome to Health Insights Plus. You need to hear this if you've ever felt that strange, burning or gnawing sensation right in the pit of your stomach. Maybe it hits you after a big meal, or maybe it sneaks up when you're stressed or haven't eaten in a while. That discomfort can be annoying, distracting, and sometimes even a little scary. It's easy to brush it off as simple indigestion, but sometimes that pain is your stomach lining sending an SOS. This is what we call gastritis, a condition that's more common than you might think. Gastritis can affect anyone, regardless of age or lifestyle. Understanding what's really going on inside your body is the first step to finding real relief and preventing future problems. It's not just about popping antacids or reaching for quick fixes. To truly protect your long-term health, you need to get to the root cause of your symptoms and make changes that last. Everyday habits, like eating too quickly, grabbing fast food, dealing with constant stress, or taking painkillers for aches and pains, can all irritate your stomach lining and make things worse over time. Today, we'll break down what gastritis really is, what causes it, and how you can work with your doctor to manage it effectively and safely. We'll talk about the signs and symptoms to watch for, the tests your doctor might recommend, and the treatments that can help your stomach heal and get you back to feeling your best. If you've ever wondered why your stomach feels upset for no clear reason, or if you're tired of that nagging discomfort, you're in the right place. Let's dive in together, learn how to take care of your stomach, and discover the steps you can take to start feeling great again, inside and out. So what is gastritis? Simply put, it's inflammation of the stomach lining, the mucosa. This lining protects your stomach wall from strong digestive acids. When it's damaged, acid irritates the wall, causing pain and discomfort. Gastritis comes in two main forms, acute and chronic. Acute gastritis is a sudden short-term attack, often from alcohol, medications or stress, and usually resolves quickly. Chronic gastritis is long-term, developing gradually, sometimes with few or no symptoms. Chronic cases are often due to persistent infections or long-term irritants and can cause lasting changes if untreated. Knowing which type you have helps your doctor choose the right treatment. The key issue in both inflammation of your stomach lining. Gastritis is a condition that affects millions of people worldwide, but its causes can be surprisingly varied. The most common cause of chronic gastritis is a bacterium called Helicobacter pylori or H. pylori. This tiny organism is found in the stomachs of many people, often without them even knowing it's there. H. pylori burrows into your stomach's protective lining, making it vulnerable to acid and inflammation. Over time, this can lead to irritation, pain, and sometimes more serious problems if left untreated. Many people have H. pylori without symptoms, but for some it leads to chronic gastritis and even ulcers. It's important to remember that not everyone with the bacteria will get sick, but those who do may experience ongoing discomfort or digestive issues. Another major cause is regular use of NSAIDs, painkillers like ibuprofen and aspirin, which strip away the stomach's protective layer. These medications are common for treating pain, but overuse can damage the stomach lining and increase the risk of gastritis. Excessive alcohol, severe stress, and certain illnesses can also trigger gastritis. Drinking too much alcohol irritates the stomach, while stress and illness can weaken your body's defenses, making it easier for inflammation to develop. Rarely, autoimmune reactions, viral or fungal infections, bile reflux, or radiation can be the cause. These less common triggers can make diagnosis more challenging, but they're important to consider, especially if symptoms persist. Identifying the specific cause is crucial, as treatment targets the root problem. Your doctor may ask about your lifestyle, medications, and medical history to get a clearer picture. Your doctor will help pinpoint what's behind your symptoms, sometimes using tests or scans to confirm the diagnosis and rule out other issues. Treating the cause is the first step to healing, and with the right approach, most people can find relief and return to their normal lives. Gastritis often announces itself with a gnawing or burning pain in your upper abdomen. You might feel better or worse after eating, it varies. Nausea, vomiting, early fullness, loss of appetite, bloating, and indigestion are all common. In severe cases, vomiting blood or coffee ground material signals bleeding and needs urgent care. Some people have significant inflammation with mild symptoms, while others feel intense pain with only mild irritation. Sometimes, there are no symptoms at all, especially with chronic gastritis. That's why persistent stomach issues should always be checked by a doctor. You can't judge the severity just by how you feel. Early diagnosis is key to preventing complications. When you visit your doctor with stomach discomfort or digestive issues, the diagnostic process begins with a thorough conversation. Your doctor will ask about your symptoms, such as pain, nausea, bloating, or changes in appetite, as well as your diet, daily habits, and any medications or supplements you take regularly. This initial discussion helps your doctor understand your unique situation and identify possible causes of your symptoms. It's important to be completely honest about your use of painkillers, alcohol, and tobacco, since these can all irritate the stomach lining and are key clues in diagnosing gastritis. Even over-the-counter medications or herbal remedies can play a role. If your doctor suspects an infection with H. pylori, a common cause of gastritis, they may order non-invasive tests. These include a urea breath test, which measures certain gases in your breath, or a stool antigen test to look for signs of the bacteria in your digestive system. Blood tests can also be used to check for H. pylori antibodies or signs of anemia, but they can't always tell if the infection is active right now. Still, they provide helpful information about your overall health. If your symptoms are severe, persistent, or don't improve with initial treatment, your doctor may recommend an upper endoscopy to get a closer look. During this procedure, a thin, flexible tube with a tiny camera is gently passed through your mouth and into your stomach, allowing the doctor to directly examine the stomach lining for redness, swelling, or ulcers. While performing the endoscopy, your doctor may take a small tissue sample called a biopsy from your stomach lining. This sample is sent to a lab for detailed analysis. The biopsy can confirm inflammation, check for the presence of H. pylori, and help rule out more serious conditions like stomach cancer or other rare diseases. All these tests work together to help your doctor make an accurate diagnosis and create a treatment plan tailored to your needs. Sometimes, gastritis is discovered unexpectedly when doctors are investigating other digestive problems or symptoms. Getting the right diagnosis is the foundation for effective treatment and long-term relief. Don't ignore persistent stomach pain, nausea, or other symptoms. Schedule a checkup if you're concerned. Early diagnosis and intervention can prevent complications and help you get back to enjoying life. Remember, your doctor is your partner in maintaining your digestive health and overall well-being. Treating gastritis means tackling the cause and helping your stomach heal. If H. pylori is found, antibiotics are prescribed, usually a combination for 2 weeks. It's vital to finish the full course, even if you feel better. Acid-reducing medications like proton pump inhibitors, PPIs, or H2 blockers help the lining recover. Over-the-counter antacids can provide quick, short-term relief. Sometimes, protective medications like sucralfate are used to shield the stomach lining. Removing irritants like NSAIDs or alcohol is essential. Your doctor may suggest alternative pain relief if NSAIDs are the problem. The goal: eliminate the cause, reduce acid, and protect the lining for full recovery. Follow your treatment plan closely for the best results. Medication helps, but lifestyle changes are just as important for recovery. Identify and avoid foods that trigger your symptoms. Spicy, fatty, acidic, or caffeinated items are common culprits. Keep a food diary to spot patterns. Manage stress with exercise, mindfulness, or hobbies. Stress can worsen gastritis. Eat smaller, more frequent meals instead of large ones. Avoid eating close to bedtime to reduce irritation. Quit smoking. It increases acid and weakens your stomach's defenses. Cut back or eliminate alcohol for better healing. These changes aren't just for now, they help prevent future flare-ups. Support your stomach with healthy habits for long-term wellness. Ignoring gastritis can lead to serious problems. Chronic inflammation may cause peptic ulcers, painful sores that can bleed and require urgent care. Atrophic gastritis can develop, thinning the stomach lining and impairing digestion. This can lead to vitamin B12 deficiency, anemia, and even nerve problems. Long-term untreated gastritis, especially from H. pylori, increases the risk of stomach cancer. Treating H. pylori reduces this risk and stops ongoing damage. Persistent symptoms should never be ignored. Gastritis is more than a tummy ache, it's a warning sign. Work with your doctor to treat the cause and protect your health. Early action prevents complications and keeps your digestive system strong.